has affected countries in different ways. Economies have been crumbled, and many loved ones cannot be with their families as they used to. What's clear is that this is affecting men and women differently. On this episode of the show, I'm talking to a medical doctor and a development expert, and we are going to explore how the virus in different countries have affected men and women, especially in Cameroon, and the role of rural women in the response strategies that are being put out. Welcome to the show. My name is Bella Ike. So, Doc, tell us, where are we in Cameroon as far as preventing the coronavirus is concerned?
As of now, the coronavirus is really multiplying in the various regions in Cameroon. Up to date, we have over 2,000 cases which have been tested positive and over 63 deaths, if I can keep track of the records.
Okay.
And in Bamenda, for example, we have between above 11 cases which have been tested positive. So far, we have a complete setup at the regional hospital where patients are screened when you come to the hospital. First of all, one of the preventive measures is there is a checkpoint at the hospital where they take your temperature, evaluate you by doing a simple checklist to see if you are at risk of developing the symptoms or if you're affected. And after that, you have the opportunity to be tested in case you're symptomatic. So at the level of the hospital, the tests are made available at the reference laboratory,
Okay.
which the results can be available between 24 to 48 hours.
Okay.
So it's still not, it's much more advanced when it comes to diagnosing those cases in our setting at the moment.
Thank you. Florence, you, from a development standpoint, do you think that we're ready to really prevent the virus in Cameroon? Prevent the spread?
I will start by saying that we are dealing here with an intersectional kind of pandemic.
Okay, what does that mean?
This means that before the virus came, it came and met people who have been going through, especially violence against women. Now we are dealing with a violent conflict and now a health pandemic.
Okay.
So if you have to evaluate our prevention, our readiness, we will see that it's much more difficult for Cameroon because we are already having so much in our hands.
Mm-hmm.
And Cameroon being at this stage is very challenging. And I think we need to double our efforts. And doubling those efforts will have to be partnerships, very close partnerships, because we are all affected. We are all in this together. We don't know who may contract the virus.
Is there a particular group of people who are more susceptible to getting infected by this virus?
From the current pandemic, we have it that people who are much older, the elderly, they're more susceptible. Those who are having other comorbidities like diabetes, for example, high blood pressure, asthma, or any other respiratory disease of chronic state. So they are more susceptible. So that's why you see them emphasizing that older persons should stay at home and they should avoid social gatherings and all of that.
Very, very correct. Now, Florence, you made mention older people staying at home, and we know that children are out of school now. What does that mean for women in rural communities?
It means more work for women and more care for them. A lot in their hands already. And for a woman to be able to put in this lot, she must be up to that. She must have the capacity to be able to help these children and the older women at home, because the position of the woman, as we already know from time immemorial, is care, with the caregivers. We know that the women are supposed to be home taking care of children from our how we grew up knowing. So in our society, it hasn't changed much. So women now have much more than they had to do before, because when the children are in school, at least they have space and time for themselves. So it's a call for all of us to help these women train themselves, gain the capacity to be able to help, to be able to stand up, and most especially to avoid cases where a woman will go into violence. Because as we know, social distancing all over the world, I was reading from the WHO report, the UN Women, all of it hold that a lot of women during this COVID-19 period has experienced violence. At least one in every three women experience more violence than before, because
before.
in our society, it's something that has been, and that's why, as a civil society activist, we have always advocated for violence against women to stop. And now that we have a pandemic, and even much more in our case with the violent conflict, women have a very, very great role to play. And these women cannot play when they're dead or when they're sick. They
Doc,
need to be strong.
Are you guys factoring in all of these issues in your response mechanism? Do you think that women have what it takes to take care of the older people in their homes, or to even prevent the virus? Are we considering that
I think women have what it takes to
in terms of
contribute.
training and
Yes.
capacity?
Yes, we have a lot of, when you talk about training, that's an important area, because part of the prevention is giving out information. And we know as human beings, we have the tendency to forget, for example. So we really advocate that women can get together. They have more meetings than men, of course. Small groups where they can train each other. Wherever they meet, they take it into practice, like the preventive measures, how to distinguish between which is a good mask, which is a good protective equipment to use, how to train people on hand washing techniques.
Okay.
I think hand washing, for example, is supposed to be, previously, we never used to wash our hands as frequently as now. So right now, they have to know the right methods. It's not just about taking your hand and washing and all of that. So
What is really the right method? And in a rural community where water, first of all, is an issue, do people know what type of water to use? Do they know how to wash their hands? Would you mind showing us how exactly are we supposed to wash our hands? What do we?
help people, please.
Should
Thank
I
you.
do it?
Yes, please.
Okay. We have here, this is just for the demonstration. The first thing you do is you try to make the areas which you have to wash up to your wrist free. Then you wet your hands with water, a little bit of water, both hands. Then you apply the soap. You apply the soap in your hands. The first step is to scrub inside your palms.
Okay.
As you scrub, you make sure it touches all the areas which the palms come in contact. The next step, you scrub behind your knuckles, in between the digits. I'm starting to scrub my left hand,
Okay.
and then I move over to scrub the right hand. That's the back of the hand.
Okay.
The next step is to scrub in between the digits in front. You scrub for a few seconds. Then after that, you grab your fingers and interlock them, and you scrub. I'm
So
sure
we
you've
don't really
never.
have time to go through all of these stages.
It's just about 7 steps. If you follow them, if you repeat them, you can master them easily. The
Okay.
next step, you grab your thumb and you scrub. You change, you scrub. The last but one step is to scrub your fingernails. So your fingernails are supposed to be cut short in this case. So most women will have to trim their fingernails to effectively wash their hands. You change and you scrub this way. And finally, you scrub your wrist
Wow,
Okay.
that's.
on both hands.
I didn't know this part.
Yes, so after this, you rinse your hands. So the water has to be running. Can I have some? So it could be a tap, it could be a modified bucket, but make sure the important exercise is the scrubbing. You scrub for at least 20 seconds. The soap it could be this soap or any kind of soap, since there are so many, there are variety of soap that we have in the market. So this is the essential hand washing technique which we should advocate and teach everyone in the community as a first method of preventing
Preventing the virus.
the virus.
Thank you so much. So even if you don't have running a tap, so someone can help you to pour out the water just so that you're not washing in a bowl of standing water. Ladies and gentlemen, if you're just joining us, this is Straight Talk, and we are talking about the gender dimensions of the coronavirus and the response strategy. Now, recently, the government of Cameroon added 19 other points to the prevention strategy, and part of that was the tax cut to a lot of businesses and institutions. Now, my worry is, in a setting like Bamenda, where we have, the number of people into small businesses and the informal sector is very large. 70% of whom are women. Now, what does that mean for them? And we're encouraging people to stay at home as much as possible. What happens to a woman who is a breadwinner? How does she take care of her family? What do you think, Florence?
The truth is, our Cameroonian economy relies on the informal sector. If you look at the GDP of Cameroon, 70%, as you said already, is on the informal sector. And I'm sorry to say that tax cut and the tax reduction hasn't affected the informal sector much, because if I remember, yes, there are some few banks and companies which are part of the not part of government who are going to benefit, but most of those who should have been considered, at least grassroots organizations, as you said, women make up 70% of that population, and they merely struggle daily to get to feed their families. And the measures really have not affected them, because instead they have given room for those people to benefit at the expense of those who are actually supposed to benefit. And it's worrisome, because putting a woman in this position is unfortunate. She is the one who is supposed to go through all the hurdles, to go through a lot already in her family to feed the children who are constantly home. And we know that when the children are home, they eat more. And it's also advised that don't go out until it's very necessary. We understand that most men don't go regularly to their jobs as they did before. And the burden lies on the shoulders of women. So what is our position? What are those things that we'll do to help them during this crisis? Now, if you give room for this virus to penetrate, because people move now normally, people have the transport sector that have called on them to load normally.
Doc, where are we with preventing the virus when we still have interurban transport? We still have markets as populated as they used to be. Where are we with that?
Yeah, I think we're really far behind when it comes to fighting this as a community. Though, like I said in the beginning, the hospital is trying, but I would say that it's more of prevention. Yes, so we can't really say we have enough material to do everything. If everyone becomes infected, or let's say even 20%, that would be a huge mess for us. Even the women who are who go to the markets, get to the markets, you see the situation there. It's just terrible. Some institutions or some marketplaces, some businesses, they have the bucket, the famous bucket with the tap, and so they try their best to put the people to order by washing their hands before getting in. That is good, but if it's implemented by everyone, it's really going to tame the virus, the spread of the virus to a certain level.
Right. One thing we must know is that curbing this virus is all our responsibility. Florence, we're running out of time. What would be your last words?
People, let everyone get involved. Take your health into your own hands. And remember, you are not doing it only for yourself. You're doing it for the next person, because when you get infected, your family gets infected. And I'm calling on the women who have always taken the lead in society. Please don't relent, because we cannot only rely on our government. Thank you.
Thank you so much. The last word.
While we are doubting if the virus is real and whether it can affect the black race or whether it can affect only old people or young people, just keep washing your hands, put on your mask, maintain your social distance, and avoid touching your mouth, your ear, or your nostril, because this virus is a virus which will do everything to get to your lungs or your respiratory tract. So those are the areas where you think it can go through.
Thank you so much. Thank you all so much for coming. It was a pleasure. That was it for us on this episode of the show. We're struggling to look at the gender dimensions of COVID-19 and how it affects women especially. Until next time when we come back, please stay home and stay safe. Thank you.